alcohol-related antisocial behaviour and experiences of this and how that kind of interacts with deprivation. As was said, I'm from the Institute of Alcohol Studies in London, and Carly is from the University of Liverpool. We're really pleased to have been able to answer the questions we're answering here using a data source like the Crime Survey for England and Wales from the Office for National Statistics. So I'll hand over to Carly.
Carly, you're on mute at the moment, just so you know.
I'll start again, sorry. Thank you, Lucy. Yeah, we're also delighted to be here off the back of a commendation from ONS for our collaboration and impact, so between the Institute of Alcohol Studies and the University of Liverpool. We've received a positive reception thus far to some of these findings that we're going to present today, including on the slide here, a comment from Andrew Brown of Public Health England, suggesting that the work does have sort of significant translation into policy and practice, and we welcome your thoughts on this towards the end as well.
So alcohol is associated with a huge variety of harms, but a recurrent finding in alcohol harm research is that these harms just aren't evenly felt across society. So if we think, for example, about alcohol-related mortality and illness, we know that the people in the lowest SES groups, despite drinking less on average than other groups, experience those harms to a greater extent than others. And this got us thinking, well, what about crime, violence, and antisocial behaviour?
Because, of course, we know that a large proportion of violent offences do involve alcohol. Some facts and figures on the slide here. The Crime Survey indeed suggests that around 40% of such offences are thought to be alcohol related, and National Probation Service figures also suggest that alcohol is a factor in many different crimes, including assaults, murders and rapes, and estimates range there between 50% and 80%. Of course, beyond just crimes, there is a lot of antisocial behaviour and disorder associated with alcohol consumption, and indeed of the many penalty notices for disorder that are issued. Most of these are for alcohol related transgressions. When it comes to thinking about violence, clearly, and perhaps never more so than in the last 18 months, we might want to think again about disaggregating trends between those types of offences that occur in the public sphere and those that occur in more domestic settings. So in fact, there's a commentary not that long back, several years back now, that looked at the evidence base around alcohol and its role in domestic violence in particular. And having examined the scientific evidence base, they concluded that we've reached a point essentially where we can conclude that heavy drinking plays a contributory role in such violence. And estimates may vary across studies ranging from 25 to 73%, but we can clearly come to a point where we know that this is playing a role. Likewise, a lot of the emphasis thus far has been around stranger violence, perhaps that sort of violence that occurs as a result of alcohol consumption in city centres and nighttime economy settings, and more than a third of alcohol-related violent incidents at the turn of the century were thought to have occurred between strangers. Moreover, there are associations that have been found in several studies between alcohol outlet availability and violence, and we've got one example showcased on the slide here relating to Cardiff's entertainment district, and a study that identified that the capacity of alcohol outlets in Cardiff's entertainment district was directly proportional to the number of serious violent incidents that there were in that setting.
So as Carly also already mentioned, we know that antisocial behaviour can be associated with alcohol as well. Obviously, antisocial behaviour is slightly more subjective than maybe violent incidents. An experience that one person may have that they might call antisocial behaviour, another person might not even register. And while the term antisocial behaviour might have been used by some kind of imprecisely in the past, there are incidents that this term covers that are really impactful for people, and we shouldn't forget that. So focus group research and survey research looking at the experiences of Londoners around 15 years ago found that experiencing antisocial behaviour can affect someone's sense of safety where they live and actually shape their decisions about where they are going to stay. So despite all that we know about links between violence and antisocial behaviour and alcohol, we don't have any sense of how these experiences are spread across society. So there is some evidence that's already touched on this, but it's generally conflicting. So work using British crime survey data from around the turn of the century has found that unemployed adults were experiencing higher rates of alcohol-related assault than others. Some work from Scotland using hospital admissions data found that alcohol-related facial injuries were disproportionately affecting young men from socioeconomically deprived areas. But international work from Australia using police data looking at a neighbourhood level has found the opposite, where they've seen that higher SES neighbourhoods are associated with alcohol-related crime. Obviously, there's differences between these data sources, and alcohol-related crime is a broader category than just violence, but still, there's not really enough here to point one way or the other. We've got similar findings for ASB as well. So having your sleep disrupted because of somebody else's drinking, for example, has been linked to deprivation.
So really, coming back to Lucy's earlier point about the distribution of alcohol-related health harms more generally, we know that alcohol plays a large role in a lot of violence and indeed antisocial behaviour, but we know less about how this is spread across socioeconomic groups. There has been some work, including some earlier analysis of the then British crime survey in relation to alcohol-related assaults, which found that rates of alcohol-related stranger violence and alcohol-related acquaintance violence was higher amongst unemployed adults, and that those in low household incomes were also experiencing the higher rates of alcohol-related acquaintance assault. But since that was around years 1996, 98, 2000, there has been limited studies that look at this, and no studies have specifically compared and disaggregated between the different types of alcohol-related violence to include domestic violence as well. We also wanted in this study to control for a range of other risk factors which we know to be associated with violence, and I'll speak to those in a little bit. So in this study, what we did, and Lucy will chip in and tell me if I've missed anything, I'm sure, but we essentially combined 5 waves of the crime survey for England and Wales between 2013-14 to 2017-18, which we accessed through the Secure Research service. And this gave us a good large sample size, having pooled 5 waves of the data to examine what is thankfully still a relatively rare outcome, a violent crime, especially when we start to cut that violent crime by so many different potential risk factors in our analysis. It was important for us to have a reasonable sample size to start with. And from using these data, we calculate, and when I say we, I do mean Lucy. I must mention that now because Lucy did the heavy lifting in this regard. Lucy calculated incidence and prevalence rates for each form of violence. So for violence as a whole, and then also for 3 subtypes of violence: stranger violence, acquaintance violence, and domestic violence. So incidence and prevalence rates were calculated for all those forms of violence and by socio-economic group. So incidence rates refer to the number of incidents per thousand population in the past 12 months, and prevalence rates refer to the percentage of people that had experienced these sorts of crimes at least once in the last year. I'll go into a bit more detail about the 3 socioeconomic status measures that we used in the next slide. But having looked and examined the incidence and prevalence rates, we also pursued some of regression analyses where we looked at the different violence outcomes by socioeconomic group, whilst controlling for some of the other known risk factors associated with violence. So a little bit more about our measures. We knew obviously whether a violent incident was acquaintance, stranger or domestic violence, but within the crime survey for England and Wales, there's also an indication as to whether or not the victim believed their assailant to have been under the influence of alcohol at the time. So we also incorporated this in our outcome measure to determine whether or not someone had been a victim of alcohol-related violence, be that stranger, domestic or acquaintance violence. We then employed 3 different socioeconomic status measures independently in calculating the incidence and prevalence rates. Initially, we used household income, housing tenure and occupation. And the reason behind using 3 different forms and repeating our analyses using each different measure was essentially as a form of sensitivity analysis. All of these 3 measures are useful, but are necessarily imperfect. So by repeating the analyses using different measures, we can sort of compare and see whether or not the patterns that we're observing hold across all measures or not, i.e. whether there is some real expected patterning happening out there in the real world. When it comes to the regression modelling, we also were able to include several other risk factors: the sex of the victim, their age, whether or not they lived in rural or urban areas, whether they had a disability, and the extent to which they visited pubs and clubs as well in their leisure time.
So this is our results table, which has a huge amount of information in it, but I'm going to take us through it kind of step by step, so it's hopefully not quite so intense. Just a quick note on the footnote, I've included the counts for violent incidents unweighted when we're measuring SES by housing tenure, just if anyone wanted a sense of kind of the raw numbers underneath all this. But this was all conducted on weighted data. So let's start with alcohol-related violence overall. We can see that when we're measuring household income and occupation, when we're using those to measure SES, we're seeing a clear pattern in prevalence rates. It's the lowest SES groups who experience the highest prevalence rate of this. So as Carly mentioned, that's the proportion of people from that group who had experienced this kind of violence at least once last year. When we look at housing tenure, it's not the lowest SES group that has the highest prevalence rate, that's private renters, but social renters still have a much higher prevalence rate as a group than owners. If we move over now to domestic and acquaintance alcohol-related violence, the patterns are much clearer. So however we measure SES, it's the lowest socioeconomic groups that have the highest prevalence rate for these kinds of violence. And we're also starting to see the similar patterns in the incidence rates as well. And before we move on, I do just want to zoom in on some of these gaps. So if we think about domestic violence, alcohol-related domestic violence, and if we measure our SES by housing tenure, we can see that social renters were experiencing 14 times as many of these incidents as a group when you compare them to owners. And that gap to me was quite staggering. So these are quite chunky gaps. If we look over now at stranger violence, the pattern is more, there really isn't this pattern there. Housing, tenure and occupation, if there are SES measures, it's generally kind of the middle groups that have the highest rates for this. But if we look at income, it's the wealthiest people. But this all makes sense because we've seen a pattern in alcohol-related violence overall, and then we've seen much stronger patterns in domestic and acquaintance violence underneath it. So they're the kinds of violence that are really driving this inequality, and stranger violence is kind of muting this pattern in the overall picture. So if we go to look at alcohol-related ASB, the measures in the crime survey that talk about ASB are not quite structured the same way as the violence measures, so we can't do the same kind of prevalence incidence rates, but we can create a similar picture. So this is the proportion of each SES group which experienced alcohol-related ASB last year. So this is kind of a prevalence rate, and as you'll see, there's no real pattern here. It's around 10% for every SES group. There's no huge differences, at least consistently, between lower and higher SES groups. When we start asking questions about frequency, though, that's when patterns really start to jump out. So all of those who had reported experiencing alcohol-related ASB last year also reported how often they experienced it. So this is column 1. So as you'll see, now the lowest SES groups amongst those victims, they are experiencing this weekly or more. To a bigger chunk of them are experiencing this weekly or more compared to their higher SES groups. And sometimes you'll see the proportions of the victims that are experiencing this every week can be as high as above 50%. So really, when we look back at that kind of flat pattern of ever experiencing this ASB, it's actually hiding quite different qualitative experiences, whereby more than half, in some cases, of those people reporting it are actually having it happen to them every single week. You can see this graphically. You can see just how strong that pattern is, much like was the case with the tables I showed for violence.
And so what I hope you've taken away from Lucy's overview there of the findings is essentially the message that we want to relay, which is that socioeconomic status remains a key risk factor for alcohol-related violence, no matter how we measure it. Granted, the patterning is less pronounced when it comes to alcohol-related stranger violence. In that instance, lower income, for example, was a protective factor, and we might think about that as, you know, those are the people that perhaps haven't got the funds or resources to engage in nighttime economy leisure pursuits, for example. So it is a slightly different underlying mechanism at play there. But when it comes to alcohol-related domestic violence and acquaintance violence, really, no matter how you look at it, using whatever socio-economic status measure, those in more deprived, those less well off, are more experiencing more of the alcohol-related violence in those forms. We, of course, in our regression models also include the other risk factors, and none of the findings will be particularly surprising, but we have just included them here. So males on the whole associated more so with alcohol acquaintance and stranger violence, whereas females more likely to be victims of domestic violence. And as the violence literature more generally will testify, it's younger people, those having a disability, and those that do attend pubs and clubs that are more at risk. So this got us thinking about where it leaves us in terms of social policy and practice, and how we might go about reducing this inequality. I'm not sure we have all the answers, and so we do welcome your thoughts and comments in the discussion that ensues after the presentation. But in our paper that relays these findings, we suggest that along with actions aimed at addressing environmental and economic drivers of socio-economic inequality, clearly the provision of publicly funded domestic violence services is a priority and does need to be improved, especially in lower for access by lower socioeconomic communities or in lower areas of low socioeconomic status. But it also got us thinking about the potential for alcohol pricing and availability interventions. And we think these should be investigated further for their potential to disproportionately benefit the lower socioeconomic groups. We've seen price repeatedly linked to alcohol-related violence, and we also see that rates of violence are higher in areas with more alcohol outlets. In relation to health harms and outcomes, minimum unit pricing as a potential intervention has been modelled and seen to potentially improve health outcomes for the lowest socioeconomic groups to the greatest degree. However, this hasn't been explicitly examined for its potential in reducing violence from a more criminal justice angle. In the criminal justice policy arena, there's been a lot more focus on policing individuals and kind of responding to intoxicated patrons and individuals in nighttime economy settings. In reality, this is limited in addressing this wider inequality, and we would like to urge, kind of thinking about some of these more structural drivers of violence and antisocial behaviour, which are both gendered and socioeconomically driven. We're moving on. Okay. So we've raised these findings and thoughts in several arenas to date. They have been welcomed and discussed in debate stages concerning the domestic abuse bill. And I think the point that I was going to make on the previous slide, which I forgot about, is again that focusing on policing nighttime economies and cracking down on intoxicated patrons is going to have limited utility when a lot of this inequality has been driven by domestic abuse in particular. The findings have also been considered by the Commission on alcohol related harm and featured in some of their reporting as well. And we have presented to the cross-party group on alcohol, drugs and justice. And we've seen our findings raised as written questions by MPs and parliamentarians as well. So I think that's a little bit about where we've presented thus far. Clearly the audience today are a very different audience, and that's a great thing, because we really hope that we can get some interesting questions and thoughts and reflections from yourselves on where this leaves us, where this work leaves us. We have had some thoughts, particularly in the wake of the pandemic, as to the salience of some of these findings as well, especially as they relate to domestic violence. I'm sure Lucy can always add some thoughts and reflections on that as well.
Thanks, Carly. Yeah, if anyone would like to look at our findings in more detail, here are our publications. And yeah, just to echo what Carly said, I think it has been really positive to see the receptiveness that some policymakers have had to our findings, particularly at a time when maybe alcohol-related violence isn't at the forefront of people's minds, but clearly this is a kind of social justice problem that we need to be thinking about more carefully. So we've been really grateful to be able to present it all of the places that we have, and we'd be really grateful to hear your feedback as well. So that's everything. Thank you.
Thank you very much, both. And perhaps I'll I'll read out some of the questions, but please do, if people want to ask questions directly themselves, then please do put up your hand, and I'll give you the floor to speak to Lucy and Carly. But the first question that's been asked by Woody, in fact, there's two questions. But firstly, at what age does alcohol begin to be associated with antisocial behaviour? Our old work suggested the relationship begins as soon as young people are in secondary education.
I don't know that we are in a position to answer that from the work that we did, but I think it's really important. One of the things that was in my mind a lot, we were obviously working with the crime survey, the adult mode rather than the child mode. And one thing that was in my mind though is when we're talking about pockets of people in the lowest SES groups that were experiencing this kind of ASB every week. If that's things like noise, if that's, you know, things that might be keeping a child up, things that might be upsetting children, that was really concerning to me, thinking about this isn't just necessarily something that happens to those individuals, but to their whole families. I think children are a really important part of the conversation. I don't know, Carly, do you have anything further?
I just want to add that, yeah, we didn't look at age of onset in this study, but that more generally, the literature on the drinking arc and the age crime curve do tend to overlap. So it's as the comment suggests, you know, it's as young people start to find their independence, you know, in those sort of early sort of double figures age, as ages enter double figures. And into the teenage years where people experiment with alcohol is also the sort of time that offending potentially is also see an onset of offending, and it peaks kind of 18 to 24 for kind of both alcohol consumption and violence, which presents a particular conundrum.
Thank you. I'm being informed that my video is frozen, which is probably no bad thing, to be honest. But I've got a couple of questions from Woody, if I can, or I think one's a question, one's a comment. So does disability include intellectual disabilities? These are common, and dyscontrol, poor social skills often add to the disability. And then similarly, I think a comment, prisons are bursting with inmates with mild, moderate intellectual disabilities. And if you've got any thoughts on those two questions or comments?
Yeah, so the item we used from the survey to measure disability was the question, do you have any physical or mental health conditions or illnesses lasting or expecting to last 12 months or more? And then there was a list people were presented with that included vision, hearing, mobility, dexterity, learning or understanding or concentration, memory, mental health, stamina, socially or behaviourally or other. So that's the kind of prompts people were getting, but people could also share their own comments as well.
Okay, thank you. And there's a question from Mary. I know works in our stat support team. So, oh, come on, sorry, somebody was asking a question there. Oh no, sorry. You have included gender, age, locality, rural/urban, and disability as covariates. Do you have any plans to expand your research to look at other protected characteristics, e.g., ethnicity, sexuality, gender transition, or is that data unavailable? And then the second question. This study looks at the SES of the victim. Is there a way to compare this to the socioeconomic status classes, etc., of the perpetrator in other data sets?
I think Carly's going to be better placed to answer the second question than me. She's got much more experience with that. I think with the first question, so yeah, obviously when we were sort of crafting this work, the more risk factors we controlled for, the bigger pool of data we needed. So we did have to be slightly strategic and think about what we were including, but I am really interested in those other protected characteristics as well, and I think that's something that would certainly be of interest. And I know the Institute of Alcohol Studies is starting to think about some of those things at the